Hello, friends. Again, we'll talk about various parameters to evaluate the food, whether it is safe for a diabetic patient, and will help him to manage his diabetes well. So, there are few points which needs to be considered. Like first and foremost is what is the core glycemic index of that food. Another point is glycemic load, how much blood sugar it is going to increase when the person is taking this food. Total carbohydrate content, what are the dietary fibers present in that food, what is the quantity and the quality of lean protein which is present in the food, fat quality and quantity, added sugar levels. Now, calorie dense is something which is more important in today's lifestyle because most of the foods are very calorie dense. So, even if you take a small portion of a meal like a pie, it may have 600 to 500 kilocalories. So, that's also need to be considered. Now, since blood pressure also is a common problem with diabetic patients, and overall the incidence is very high, so every time we need to evaluate what is the sodium content and whether it is a processed food or a ultra processed food. Total calorie intake also depends upon the food that you take. So various parameters that may influence a diabetic patient to manage his blood sugar levels and to optimize his insulin needs in these patients. So we need to follow all these 9 to 10 parameters to evaluate a diet plan for a diabetic patient. So it's not that easy, but it's not that difficult also. So at the same time, you need a dietitian once in your lifestyle to assess whether the food that you are eating is good and is helping to manage your diabetes, or it is creating a problem to increase your blood sugar levels. Right. Thank you very much for listening to this video.